will do that.
Okay, good morning, everyone. My name is Godia Eziagula. I'm the Director of Daughters of Abraham Foundation.
Okay, you are welcome, Ma. Thank you for finding time to be here.
Okay, good morning, everyone.
Good morning.
I'm Obiagu Vivian Ben, ED, Bethesda Foundation. So it's nice meeting you all again. Happy International Women's Day.
Thank you. Nice to meet you today. Next person, please.
Hello. Good morning.
Good morning.
I'm Odette Etamen, No Limit for Women Project, Null for Work, Cameroon.
Welcome, Ma. Thank you for joining us. Happy International Women's Day.
Thank you.
We have another person, someone that has not introduced myself. Okay, it seems there is no other person, but I'm seeing a good thing here. So we continue. On this seminar, it's not H alone.
Good morning, all.
Okay, good morning.
This is Mr. Simon from Caritas Boko, Benue State, Nigeria.
You're welcome. Thank you for joining. Thank you for the work you've been doing to advance the women's rights in your area. We appreciate you.
Sorry, I can't get you. You said?
Can I be heard? Good morning,
Yes.
everyone.
Good morning.
My name is Princess Stanley. Sorry, Patient Stanley. I work for Initiative for Young Women Health and Development. Thank you.
Thank you for joining us. Happy International Women's Day.
Same to you. Thank you.
Thank you. Any other person? Okay, just like I said before.
Good morning, all.
Good morning.
My name is Adedayo Simloluwa from Rays of Hope Community Foundation, Ogun State.
Thank you for joining, and thank you for the great work you've been doing to advance women's rights. We appreciate your work. Thank you.
All right, thank you.
You're welcome. Mustafa, are you there? Madam Tina, have you joined? Can you hear us? Okay, we continue. Welcome everybody to this great day. Today we are celebrating the most powerful people in the world, women. They are powerful. So we celebrate them. Happy International Day to you as a woman, wherever you are. You are strong. You are good. You can stand for your rights. You have that potential to stand for your rights. So nobody should intimidate you. We celebrate you today. So today it marked aside to celebrate all the women and to see the know the way forward. What can be put in place to make them be comfortable in their environment, in their family. And today we will be discussing on action to promote women's sexual and reproductive health rights. Thank you for joining. So we are starting so far. So today, this is the agenda we have for today. Introduction, key challenges in accessing sexual and reproductive health services, strategies for accelerating action to promote women's sexual and reproductive health rights. And when we discuss this, the topic, all this agenda is just a contribution. It's not only age, just like I mentioned before. We are not here to do like age is talking. We are all here to put heads together and to discuss the way forward. Because no matter what we are doing, gender-based violence is still persisting and women are still suffering. So we are here to talk together to know what is the way forward to promote women's sexual and reproductive health. Okay, today, as we explore this question, we welcome everyone to this seminar on accelerating action to promote women's sexual and reproductive health and rights. Today, we are gathered to discuss critical issues affecting our women and adolescent girls globally, their sexual and reproductive health and rights. Sexual and reproductive health Sexual and reproductive health, as we all know, refers to a broad range of services that cover access to contraception, fertility and infertility care, accurate information and education on the overall reproductive health and well-being. This also includes maternal health care and safe childbirth, prevention and treatment of sexually transmitted infections, and HIV, freedom from forced marriage, healthy relationship, female genital mutilation, and other gender-based violence. So before we continue, I would like to ask, when you just hear accelerate action for gender-based violence, what comes to your mind? Let's just talk before we continue. When you hear accelerate action for gender-based violence, what comes to your mind?
Okay, let me say something.
Okay.
When we look at accelerating, it means that increasing. It means something has been moving, but maybe not at a particular a better pace. But now you want to improve it. You want to increase the pace at which it is moving. It means that you are accelerating. So we've been working on gender-based, but at the rate we are moving, it's not that good enough. So now we need to put more effort, we need to increase it, which is accelerating more effort in whatever we have been doing well. Thank you.
Thank you, ma'am. Yes, accelerating efforts, putting more effort to do better what we have been doing. Thank you very much, ma'am. Please, any other person that has contribution to that?
I want to make a little contribution also. And first, my name is Gözde, and I represent today Regional Advocacy for Women's Sustainable Advancement Alliance for African Arab States. And for the accelerating action, I think the education is really important also because many women and girls in Africa, they don't know their sexual and reproductive health and rights. So if we put our effort to educate them, I think we can contribute more to accelerate action.
Thank you very much. Thank you for that contribution. That means in this case, in your own perspective, is putting more efforts in educating women on their rights, their aspects of sexual and reproductive health, because some of them, they don't know anything about that one. Thank you very much for that contribution. Any other person, please?
Hello.
Hello, we can hear you.
Okay, so for me, acceleration, when we are talking about Women's Day, I think like the previous person said, before now we've not been doing enough. Acceleration is a kind of pushing women both marginalized, the vulnerable ones, the youth, to know about their well-being, their right, and also even talked about their health, because there is a lot that women don't really know about gender issues and, in fact, generally gender as a whole. So I think acceleration this year is more of pushing women to know certain things about themselves. Yeah, thank you.
Thank you very much, ma'am. Okay, before we move forward, is there any other person that has something to
Madam
say?
Minister, you're talking and
Oh, can I say something?
Yes.
I think for me, it's like the emphasis or the need for us to take actions, to put more efforts, like others have said, taking intentional steps to address issues pertaining reproductive health or, gender health issues.
Right, thank you very much. So we are all familiar with the topic of this day, International Women's Day, accelerating action for gender-based violence, pushing forward, putting more effort to do what you have been doing to promote gender-based violence. Thank you very much. So we are continuing. So this said that despite the efforts of so many women-led focus groups put in place to advance women's rights, sexual and reproductive health rights still remains a pressing concern. So we are gathered today to address these pressing issues and accelerate action towards promoting women's and adolescent girls' sexual and reproductive health rights. Young women and adolescent girls, particularly those in the displaced settings, continue to face barriers in accessing these rights, which include limited access to education, just like one of the participants mentioned that some of them they do not know anything about their sexual and reproductive health, and non-judgmental information, gender-based violence and discrimination, restrictive laws and policies, and social economic inequalities. In response to these challenges, we must accelerate action to promote women's sexual and reproductive health rights, and this requires a collective effort, approach, and exploring ways to advance the rights of our young women and adolescent girls. In this seminar, we will deliberate on the key challenges and opportunities in promoting women's sexual and reproductive health rights, discuss strategies for accelerating action, share success stories and best practices, and as well as identify areas for collaboration and support. So we invite participants to actively involved in discussion, share your experiences, expertise, and perspective. So as we move forward, let's just do a brief introduction about African Girls Empowerment Network. African Girls Empowerment Network is a registered young feminine frontline civil society organization dedicated to reducing gender inequality in Nigeria by empowering and advancing the human rights of young women and girls. We advance gender equality in girls' education, promote young women's sexual and reproductive health and rights, bolster women's role in leadership and economic inclusion, as well as strengthen the capacity of young women's led groups. As a young women and girls organization that is advocating for our rights and the rights of other women and girls, our drive is to see women and girls being on equal footing with men, and we believe by working to secure the sexual and reproductive health and rights of young women and girls aimed on safe abortion, child marriage, teenage/unwanted pregnancy, sexual and domestic violence, cultural and social norms biases, and other harmful traditional practices, we will be able to break barriers to girls' education, promote women's economic and financial inclusion, and bridge the gender divide in STEM education. Once again, thank you for joining this. So we are moving to the next stage, Now we are looking at the factors that limit the sexual and reproductive health services. Factors that limit women from accessing sexual and reproductive health services. So not minding what is on the screen, just like we have said before, that is just a discussion, a round table that everybody will contribute. So we would like everybody to contribute on this. Before then, young women and girls, particularly those in the hard to reach communities, face challenges in accessing sexual and reproductive health services, including lack of education and information, limited transport options, lack of confidentiality from the healthcare workers, lack of referral, stigmatization, and discrimination. According to statistics, 214 million women lack access to modern contraception, ties UNFPA 2020. 38% of pregnancies are unintended. That is according to World Health Organization 2020. 22 million unsafe abortions occur annually, according to World Health Organization in 2017. 1 in 5 girls marry before age 18 in Nigeria, according to UNICEF 2020. 1 in 3 women experience physical or sexual violence in Nigeria, according to NBS in 2019. And this calls for urgently to collaborate and address the key challenges that hinder women and girls' ability to exercise their sexual and reproductive health rights. So I would like everybody to just contribute on this. What do you think are the factors that hinder women from accessing sexual and reproductive health rights services?
Okay, I'll tell everybody once again, I'm Obiago Vivian Ben from Betteriva Foundation in Delta State, Nigeria. I will say, in fact, a lot of factors has been hindering women and young adolescents from accessing reproductive health care. But I would say, in fact, like educationally, most of our adolescents, they know of family planning, the different type. But I think major thing there is fear. Hello, can you hear me? Hello?
Yes, we can hear you. Please continue speaking.
Okay. I think major thing there is fear. Fear and rumor, which boils down on educating them more. Most of our young girls, when that are already exposed to sexual life, when you talk to them about family planning, you hear them say, they are afraid of going to family planning so that they will not find challenges in giving birth later in life. And others will look at it as family planning is only meant for married women. It's only meant for married women to go into family planning. So the fear is there for most of them, what they hear about family planning. So that is another major thing, fear. Then another thing is accessing this care, these services. Hardly before you see a young girl will go to the health facility and say she wants to access family planning. How would the fear is that how would the health workers look at them? How would they address them? So looking at this issue, which there will be a special services only rendered for these young people to be able to access these services free of charge, and also being well educated, educate them on issues on reproductive health. Thank you.
Thank you, Mom. Thank you for that wonderful introduction and for that contribution. Is any other person that has something to say?
Welcome or well done, everybody. I just want to add to what the last speaker said. My name is Godia Ezeagula. I think, like she said, there are so many challenges when it comes to assessing sexual reproductive health. And she mentioned limited access to healthcare facilities, which is in fact one of the main issues also, because there are no free medical care, no free counselings and all those things, to educate these teenage girls. And I think that another issue, another factor is inadequate funding. There are no fundings for all these projects, assisting young girls, helping them to take informed decisions, checking their health, checking their status, and all those things. But I want to also point out some issues, like in all these rural areas where there's distance, no transportation, they don't even have good healthcare facilities where they are, or high cost of movement, high cost of healthcare services, and there are even no facilities. Some other challenges are like our sociocultural and religious factors, all these norms and beliefs that Africans carry as well, and their bias towards especially maybe menstrual health or women's sexuality and childbearing or forced marriage, and all these are all challenges that come when it comes to reproductive or sexual health for women. So if these things are, we can teach or sensitize. Let me use the word sensitize communities. Sensitize local leaders. Within these communities to also build capacity for their environment or for their communities. It will go a long way to also curtailing some of these excesses when it comes to how women are being perceived, And because of things like this, you see that women are in their shell. Young girls are not willing to speak about certain things because of the religious restrictions, or because of the bias about contraceptions, or like somebody mentioned, certain services because they are not married or they are single, they are ashamed or they don't want to speak up about certain things. So these are also some challenges that young girls face.
Thank you very much, ma'am. Like a social, cultural, and religious. That one, people are just like that. Our religions do not accept it, especially going for family planning. They don't like something like that. So they need to be educated. Thank you very much for that contribution. Is any other contribution? Okay, so we move forward to the next slide. Okay, now we want to look at the strategies for accelerating action to promote women's and sexual and reproductive health. I have been notified here that we have keynote speakers. Sorry that I did not really recognize you. My colleague just notified me that we have keynote speakers. That's Mr. Douglas. We have Mrs. Vivian from Bethel Foundation. We have Mrs. Godila. We have a representative from Abraham Foundation or a director of Abraham Foundation. You are welcome. So right now we want to be looking at the strategies for accelerating action to promote women's sexual and reproductive health. And I'm so glad that we have the experts here in the field. I would just ask them to make their own contribution to, to speak to this concerning this. What are asking, just like we have said before, that accelerating action means pushing forward, putting more effort to do what you have been doing to achieve more in what you have been achieving. So I would just like our speakers to speak on this. What are the strategies that how can we push more? How can we put more effort? What are the effort that we can put more to do this? Hello. Okay, since we are still preparing to say something, so we continue on the one that is on the screen. The the strategies that can be the strategies to to advance and promote the sexual and reproductive health is to improve access to education and information. It requires comprehensive sexuality education for women and girls because some of them, just like they have mentioned before, that they need education, they need to be educated on this. So it is important that they are educated more on their rights. Some women they do not know their rights. Some women they may be facing violence, domestic violence from their intimate partner, and they will not say anything. They will not speak out simply because they do not know their rights. So it is important to be for them to be educated. So another one is community outreach. It's not just like if we can take it to online, but it's not everybody that have access to mobile phone that can access this information online. So especially those people in the displaced settings, there are there are people in the village that they don't even know anything about mobile phone, what is internet, how did they get to know this information. So we have to let them know, we have to take this information to the interior part of the community to let everybody be aware of their rights as women. So the next thing here is strengthening health systems and services. This one is for our health experts. They need to ensure that women have access to quality reproductive health services, including family planning, maternal health care, and HIV/AIDS prevention and services. There are some there are some informal healthcare providers that because of their religious understanding. They do not do anything in this aspect. Just if you go there to buy condom, they will first of all preach to you that what do you want to use condom for. So we have to them too they need this training so that they can know that it is their right to promote the sexual and reproductive health of women in their community. Because I've seen it is some women they are so ashamed to go out and buy that to buy condom to even go for family planning. They will be like, if I go there, that woman will not start laughing at me. She will not be asking me what I want to use it for. They will not start preaching that you are not permitted to do that. You are not permitted to use condom. Why are you using condom for? You have to wait for the right time before you are engaged in any sexual intercourse. But whereas it is important to tell these women that are sexually active that it is important to protect themselves from unintended pregnancy, because if you're engaged in a unprotected sex, you can contact HIV, you can contact other ACI that may affect you. You can get pregnant when they are not ready, especially the students that are still going to school. They still have a brighter future. So we also need the informal healthcare providers, they also need training on the best practice to promote sexual and reproductive health. So the next thing is to address gender-based violence and discrimination. It's still just like telling people that they should not discriminate. You are seeing somebody in this, there are some people that if you see somebody that is being beaten by the husband, maybe she's the one that put herself there, she wants to remarry. We have to just join together and help women to overcome this. Another thing is to support survivors, provide support services for gender-based violence, including counseling, legal health, and shelter. And policy, another one is policy reforms. We need to advocate for policy reforms to address gender-based violence, discrimination, including laws and policies that promote gender-based violence. So another thing we have here is to leverage technology and innovation. There's there's a way that you can be sending informative information to women via SMS, bulk SMS, just on a click. Everybody, they will just, even if they don't have internet, they don't have data to go online, they will just receive it as a as a normal mobile text. So this will also help in spreading this information on promoting gender-based violence. The next thing here is engage men and boys. This thing, it is not only women that will be doing this. We need to engage men, let them know that it is their right, and especially in the case of rape, we have to let them know that to rape is a violence. They are violating women's rights. So we have to get them involved and also make them become the Bele by Choice champion advocates that will be advocating among other men to end gender-based violence and promote gender equality. So I don't know if we were preparing, do we now have something to contribute to strategies to accelerate more action in promoting gender-based violence? I've been speaking to myself all this while. Please, am I still being heard? Hello?
Hi. Yes, we are hearing. Just that I'm joining now as a result of network.
Oh, sorry about that.
So like you just pointed out, for gender-based violence, it's not something one person or one CSO can do. We need to work in collaboration. And as you said, okay, we need to work in collaboration with the government, the states, and the CSO, and even the traditional rulers, as in the community leaders. And another thing is that we need to engage men, because they are the perpetrators of this act. If they are not there to change some social norms that are causing or fueling this act, that means that we cannot achieve our target. So we need the community leaders. We need to engage them. We need to engage the government. and some CSO, so that we can create massive awareness on some social norms or harmful traditional practices when exposing this GBV in the community. And another thing is that we have a lot of policies and laws and policies that are needed to be reinforced. You understand? There is need for implementation of this law. Yes, we have laws, we have policies, but are they being implemented? So we need to engage government so that they can advocate for implementation of these policies in our states and in our country at large, because by so doing, it will help to reduce GBV to minimal effects. Thank you.
Thank you very much.
Okay, to add to what she said, can you hear me?
Yes, ma'am.
Okay, to add, she mentioned some things, engaging men. I totally agree. When she was talking, I was thinking of, because I mentioned earlier, social, cultural, and religious factors, that's also a big problem, especially here in Africa, because of the ideologies, passed down to our men, to our boys, feeling that they are the alpha, they have power over women, and then they take advantage of these things, and because of the whole gender roles, women's voices are limited. There are communities where women can't take decisions, even over their own body. They will have 10 children. They cannot even say they don't want enough. As long as the husband wants to keep having, they will continue. So a woman has been pressed. So if we can work with government, to also work with religious leaders, cultural leaders, in communities, to sensitize them, to teach them certain things, so they understand that women are human beings as well, to also promote gender equality and removing the whole gender bias will go a long way in curbing these gender-based violence issues. Another thing I thought of is intimate partner violence, and this is not just for married people. You see teenagers now, we are in an era where you see a 15 or 16-year-old boy and girl living together, and the girl ran away from home, is being abused, being beaten, and then you see a lot of murder cases and all that. And these are because we've not taken certain steps in curtailing these excesses. I think if we put things in the law also that protects women, protects young girls, you can't just up, and do certain things. Working with the communities, raising initiatives like community-based initiatives that help with all these things, family and counseling, group counseling, boys support group, and things like that will go a long way in helping.
Hi, we lost you, ma'am. Hello, good day.
Sorry, I think the network, it keeps going on and off. I don't know where I stopped. I kept talking. I thought you were hearing me. Hello? Hello?
Hi, we can hear you, ma'am. Yeah, this network issue is really bad, but I think we can hear you clearly now. You just proceed. You made mention of community outreach where you had to engage men or something.
As I was talking of community-based initiatives, having things in place for communities, for like within the community sector, religious leaders, women group, youth group, we take advantage of all these things to sensitize the community against these issues of, gender-based violence, having group counseling for families, like a structure, let me use the word structure, where young girls are being cancelled, young boys are being cancelled, because we find ourselves in an era where the girls are at the focus. We are training girls, and the boys are being left out. And like you said, they are the perpetrators. I think somebody said they are most of the perpetrators, So if we can have things like this in place where they are guided, they are taught, they are educated or enlightened, it will also go, that's within the community or the rural community sector, will go a long way to curbing some of these gender-based violence issues.
Can you hear me? Thank you very much, Ma, for that beautiful contribution. I don't know if anyone else has anything to say before we move on to the panel discussion proper. Does anyone else have something to say? Hi, Ejiro, go on. You have the mic.
Okay, good morning, everybody.
Good morning.
Okay, so my name is Ejiro from Initiative on Young Women's Health. Actually, I came in early, but my network has been wobbling, so I didn't actually start from beginning. So, but basically, what I understand is that we are talking about how to kind of reduce gender-based violence on women. I've heard the last speaker said a lot of things, and one of the things I want to talk about is another challenge they face is the issue of poverty. The issue of poverty make a lot of young girls go to stay with men. And because the man is giving them something to, maybe food, money, and the rest, even though the man is killing them or beating them, they will refuse to leave there. They will be there. So one of the things the government should be able to do when we are advocacy to the government is to find a way of helping the poor, the most marginalized. There should be a way of mapping out those that are marginalized and helping them. We've had a lot of program where government give out money and to people or give out a kind of job creation, skill acquisition to people. But most of these people, the marginalized ones, are not being reached. We just hear it on the news. We don't see the evidence of those things. So those are one of the challenges that these people face that makes them to just stick to men that beat them every day. Even the ones that are married, most time, just like my sister said, is caused by maybe parental issue. So I may have a challenge that, oh, my husband is beating me every day. And when they go back to the family will say, oh, be patient, be patient. So all this thing boils down to continuous sensitization, continuous education. That is my key. Thank you.
So much, Ejiro, for that beautiful contribution. And we await others to also share their contribution and take on this as well. Hello, please, you all have the mic. Who goes next?
Hello, since we have all made a contribution, so I would like everybody, let's take a little selfie. Please kindly on your camera. Let's see your beautiful faces. Wow. Oh, your camera. You have been seeing my face since you joined. I also want to see your own. Oh, see the faces I've been missing. Mustafa, Idris. We are yet to see your face. See that handsome face. I mean, is it beautiful face? What's there? Ooh. Nice to see these faces. Okay. It's like Uncle Mustafa is not with us at all. All right, thank you, thank you. Okay, he's here. Here. Mustafa, can you on the camera again? right, thank you for showing your beautiful faces. So we can continue now. And at this juncture, I'm hanging here for my colleague to take over. Madam Tina, can I take over?
Hi everyone, and so good to be here, and good to see your beautiful faces. All right, so just like I mentioned earlier, I think I've already been introduced. My name is Martina Avery, the administrator of African Girls Empowerment Network. I'm also a gender advocate on women and girls social reproductive health rights. Yeah, so basically we'll be moving to other discussion. We'll add a lot of the deliberations already. So we'll go deep into the discussion proper. You know, this is actually a roundtable discussion that we're going to be having where we share more about our works and all. And so far, we've been able to cover the challenges women face as regards accessing reproductive health, and also we've talked about the strategies. And then, so I want to bring in this context. So now, in the speaking about us as parents, I believe everyone who is here is a mother or intending mother, and as a parent, you should be able to. What are those? What do you consider to be the issue? You know, that is causing increase in unwanted pregnancies. Every year we've come to know that the statistics shows an increased rate of unwanted pregnancies daily. And then how do we remedy this? Doesn't mean as parents we're not doing enough. Are there other things that need to be done as parents? So please, we will love us to deliberate on this issue right now. So the question is, I'll take it again so that we get it. What do you consider to be the issue causing the increase in unwanted pregnancies? Does this mean parents are not doing much? And if we are not really doing much, what are those things that can be done better to reduce the rate of unwanted pregnancies, child marriage, and school dropout rates in our society? So please, the mic is open. Hello, we're gonna start with Madam Patience. Are you there? Hello, Madam Patience. I think would you love to go first?
Thank you very much. Sorry, I was trying to write down your question so I can actually get what you're saying.
Oh, that's right. Sorry.
So, if I may understand, you are asking what we consider to be affecting early pregnancy, right? Or can you ask the question again?
Okay, so I will just rephrase the question. I said, what do we consider as parents? What do we consider to be the issues that it causes the increase in unwanted pregnancies? Does it mean as parents we are not doing enough? And if we're not doing enough as parents, what do we need to do better in this context? So please go ahead.
All right, thank you very much. I think the things that affect it is we generally we talked about poverty. Yeah. Because no matter how the parent train the children and all of that, if the home is not okay and things are not going on well, things can turn around in a minute. Like you see some home where they can actually take a girl child and in exchange of food or money, which lead to early pregnancy. Yeah, I will talk about, like, in my state, there's a local government I'm not going to mention, where I know that what they do is that if you're owing someone and you can't pay, they can actually take a girl child even though it's 12 years, 9 years, no matter the age of the child, and using paying of the debt, which at the end of the day, of course, what would they do to the child? It will be forced sex, forced rape that leads to so many things, complications, infections, early pregnancy, and all of that. So poverty play a big major role in early pregnancy. Yeah. And also education. So if there is proper education, I see no reason some young or youth, teenager will go into early pregnancy, like start having sex. Yeah, education also play a major role. If they are educated enough, I think that will not happen. Unemployment also, it's another thing. Lack of job, yeah.
Hello, ma'am. We love you. Are you still there?
Can you hear me?
Yes, I don't know if you see that I'm hearing.
Hello, can I be heard?
Yes, yes, we are hearing you.
Oh, ma'am. Yes, go ahead, ma'am. We can hear you.
Yes, I can hear you.
Okay,
We can
so
hear you.
I talked about also unemployment. We should also play a major role because of lack of work. Our young girls go into sleeping around. Sometimes you even see the job and the manager will say they have to sleep with you first without condom, which at the end of the day, after all of that has played, they end up not giving you the job and they will still even deny the pregnancy. So all of that in a society nowadays, those are the things that I know yeah, cause the issue of early pregnancy in teenagers and the youth. Yeah.
Thank you very much for that contribution. So what about the area of increased rate of child marriages? You know, a girl is being forced into marriage. I don't think that is that they are actually it is their will or self-will for them to leave their education, you know, and go for marriage, even being forced into it of that nature. So in this context, what role do us as parents play in?
I talked about poverty, which I said is a very big problem. Yeah. When we talked about early marriage, I talked about some parents who actually be the one to take their girl child in exchange of debt to pay their debt that they are owing, which lead to early marriage. Sometimes they will even force you to marry the person that you're not supposed to marry, just because the parents know that they are owing the person and what the person is demanding is their girl child. So that's also contributing early marriage. Yeah. Poverty
So,
causes so many
like,
things. Some go into marriage in the fact that I don't have anything and the man is rich. Yeah, let me go and marry and all of that. So poverty is a major for me, I think it's part of
another
the issue.
thing, if I should all right, if I should add to what she has said, another thing is culture. Culture. Please, are you hearing me? Another
Yeah,
thing is
Yes, we can
culture.
hear you clearly.
Culture, like in the northern part of the country, there is this culture that a girl child should marry early. Do you understand? So it depends on the countries, sorry, on the culture existing in that area. Then another thing that can push a girl to marry early is when the girl did not have adequate information, or can I say correct sexuality and reproductive health information. Like there is this in this side, as in Enugu State, there are communities that the girl child marries early. Why? Because of culture. Two, because the girl is not adequately informed. Teenagers that are still in secondary school or some that have even graduated, there is a custom, there is a particular norm in that community that says that once a girl child gets pregnant in her father's house, one, she's not permitted to abort, and two, she will give birth in her parents' house, or rather, an old man will come and marry her. But I don't think that this child is well informed or got correct information or have enough knowledge on sexuality and reproductive health. You now discover that somehow, the girl will delay being involved in premarital sex. Because I don't know if you are getting me, but let me just digress a bit. There was a time we went for a program in a particular community. We discovered that most of the girls we interacted with, they came with babies. I was thinking that we are working with married women, or can I say girls? Only when I now looked, I discovered that most of them are teenagers and they all give birth in their parents' house. Then why? That is one of them. Two is the culture existing in that community. Three, because these children these girls are not well informed. They don't have correct information on sexuality and reproductive health. They don't have correct information on life building skills. Then when we now started teaching them life building skills, self-esteem, goal setting, refusal skill, negotiation skill, high and value, their eyes were opened. Because there's something that's happening. Once you are pregnant, an old man will come and marry you, or you will be forced to marry the guy that impregnated you. And you discover that most of them are not going to school. It's all about, getting married early, or they ended up being farmers, and at the end they will marry. So when we enlighten them on to know concerning their rights and how they can practice, how they can say no, how they can negotiate, say no, and talk about, and we teach them about total abstinence, and most importantly, goal setting.
All right, thank you very much. Yes. Thank you, Madam Chair, for that beautiful contribution.
So I think it still fall back in education. It still fall back in education. If they have the knowledge, they are educated enough, I think they will understand.
On sexuality and reproductive health, that's my argument. Education on sexuality and reproductive health.
Thank you very much, Patient. Thank you, Chair, for that contribution. Mustafa, do you have anything to add to that? Please, you just have 1 minute. Just summarize the contribution to a minute, please. Right here. Hello, Mustafa, are you there? All right, so let's take Gosde. Are you with us?
Yes, I am.
All right, would you love to share that?
Sorry, I couldn't hear the last sentence that you said because of my connections.
Yes, I'm with you.
Please repeat.
Hello? Hello? Can you hear me?
Hi,
yes, we can. We can.
Good afternoon. My name is Mustafa. I'm calling from Bauchi.
Hello, Mustafa. Your network is
I really want to appreciate those points that the participants have just said. Hello?
Hello, we're with you, please.
Well, there is nothing to do with the network. Hello?
Hi, Mustafa.
Hello?
We can hear you, please.
All right. Can you hear me now?
Yes, we can.
Okay. Can you hear me now?
Yes, we can, Mustafa. Just proceed, please.
All right. I just want to agree with all those points, those. Okay, I really want to appreciate the points that have just been raised. That is poverty, proper education, unemployment, culture, inadequate information. Those are very vital points that need to be considered. Because if they have those adolescent girls, there is adequate education, information to them. I don't think this pregnancy and unwanted pre-marriage and unwanted pregnancy will occur in home. Again, I want to call on our mothers, that is the mothers, they need for them to give their children, is those girls, proper education about sexual reproductive health. Very, very key. It starts from the home. If it doesn't start from the home, it will continue out and be living adults, and it should come to the parents, not to the family. Find out that there are some homes that it's those adolescents that are out to look for some down home for them to eat. That is where the poverty issue now comes in. So, except if that issue has been tackled, that of poverty and lack of education, and then employment is very, very key. Unemployment, need for those adolescents to engage themselves in income-rich activities. It's very, very, thank you very much.
Thank you very much, Mustafa. Please, goes there. Can you go on? Wait.
Hello, can you hear me?
Hi, Mustafa. We can hear you. Thank you very much. We know you have a lot to say, but we're working with time. Thank you so much. We'll still have some other time for more contributions.
Thank you.
Yes. Thank you very much.
All right.
Good
Thank you very much.
Can you proceed with your contribution?
Yes, sure.
All right.
I agree with my colleagues that engaging all members of the communities, men and boys, including it's important to promote gender equality and also prevention of the stigmatization of SRHR accessing by women and girls, and also family education is important, but for family education, there should be also like more, let's say, high level, we need more high level regulations like law regulation, government-based regulations, or like contribution of also different kind of partners, not just governmental actors, also civil society actors. And in some point, I believe also the contribution of private sector is important, like big funds and grants, or maybe some, I don't know, business owners who would like to invest more in the communities, like in more marginalized context also. And yes.
All right, thank you very much, Gozek, for that contribution. We have Odette. Odette, can you unmute your mic to say to send in your contributions? Are you with us? Itame, are you there? Hi, Odette, are you with us? All right, I guess they might be having some network issues, so we'll just call on Madam Vivian. I see you just rejoined us. Welcome back. Hello, ma'am. Hello, can anyone hear me?
Yes, I can hear you.
Yes,
Oh,
I
all
can
right.
hear you as well.
Yes, I
All
can.
right.
Okay, hello. Hello.
Hi, ma'am. Welcome back.
Okay, you can hear me now.
Yes, we can hear you, ma'am.
Okay,
Welcome.
thank you. So far, I don't know where to start. I don't know what you are
All right,
discussing.
so
I'm just lost at the middle.
we're just discussing on the issue of parenthood, and then how we can how as parents, what role the parent has to play to reduce the rate of unwanted pregnancy, child marriage, and school dropout rates that are increasing in our society.
Okay, it's a good one. I think when it comes to parenting, we have a lot of work to do because most our custom actually, when I say it's cultural, most of our kids are not being exposed to sexual education. If not now that in some schools you see there is not being introduced, but at home, these kids are not being taught anything about sexual education. So they just start to learn this thing from the school or from their peer group, and you see things go wrong. But I think parenting, even the parents need to be educated to educate their children also on how to present these things to them. Because like when I was growing up, the only thing my mom taught me was no near man, no. If you near man, you get pregnant. So I think in the class, you are sitting close to a man. So how come I'm not pregnant? So you see, that was the kind of education we had. That when you get close to a man, you get pregnant. But that lesson not teaching us actually that is when you have sex with a man, then you get pregnant. It was not there. They only tell you don't near man. So I think the parents also need to be educated on how to educate the adolescents in a way they understand it, and not just on their way. They just cover it, a kind of. When I say cover it or frame it in a way that the child will not even have a better understanding, only to get to the school or from the peer group now have a better understanding on what they actually mean about sexuality. So it should start from the home. We, the parents, need to be taught on how to present this thing to our children and when they get to adolescence. Then on unwanted pregnancy, it all boils down from the home also. It all boils down from the home also. Because when the child is being exposed from the home of the implication of unwanted pregnancy, then the child should also know what to. There was a friend of mine that told me that she saw a mother that came that brought her her daughter to the clinic to introduce her to family planning. And I said, wow, because I think the mother, maybe she have educated the child about her sexuality, and still she's being exposed to it. So she need to protect her daughter. She introduced her to family planning at that very early stage of 12 years old. She introduced her because the child was really exposed, and she was also having different kind of groups that she mingled with. So the mother, to be on the safer side and be sure that the child complete her education, she introduced her to family planning. They lectured her, and she was introduced to PIL because she had tried her best and it's not working for her. So you see, it boils down on we, the parents. So we need to be educated to educate our younger ones. Then also the implication, because I myself, I am a community person. I go around, I educate these younger ones. When I go to tell them about, they say, no, no, family planning, God forbid. I will tell them, you are saying family planning, God forbid. Are you not going to the chemist to go and buy Mistroposo to prevent pregnancy? They say, yes, now we do. I said, then you're already practicing family planning already. You're already in practice family planning. But that word, family planning, to them is like adult thing. You understand? Yes, when they hear that family planning, they say, no, I don't want family planning. But when you ask them, do you actually take any preventive thing? They say, I take Mistroposto, I take this, and then you're already practicing it. So it's just the way we present it to the adolescents also matters a lot. How do you present family planning? How do you present this thing to them? most of them are practicing it, but in the other way around. Thank you very much.
That's true. Thank you so much, Vivian, for that contribution. And so we see Ejiro, your hand is still up. Do you want to say something? Hi.
Okay. To add to what has been said so far, one of the things we should also consider is though parents try to, talk to their children, teach their children, sometimes the environment impacts on them. The pairs they move with part on them. You understand? The parent might teach them this is what you do, this is what you do. But when they go out there, they see their friend, this one don't carry belly. Now only me leave will remain. I need to carry belly. You understand? It happens. I've seen girls that because their friend is married, they want to also do what? Rush into marriage without knowing who the man is, without knowing if the man is okay for them, without even having knowledge of marriage. They want to go in because their friend is married. And some of them go ahead to even fight their parent if their parent refuse to allow them to do that marriage. At the end of the day, they enter into a marriage where they are being beaten, where they are being violated, where the man rapes them every day because the man provides virtually everything. So to the man, he is the head and everything of the child. You understand? In fact, some men will say, I have paid for you. I bought you over. You understand? Why also there are still some girls. Let me divert a bit from normal parents. We have community members which we call female sex workers. You understand? These female sex workers have a lot of children. Now, majority of their children grow up in the streets. You understand? And because their mother may not be able to provide for them, they decide to follow a man. Automatically, they start staying with the man, and automatically, they start getting pregnant and giving birth to that man, believing that there's a man to take care of them. So whatever the man does to them, they don't have a voice to say because their mother cannot provide for them, their father cannot provide for them. What do? They just stick with the man. They are not actually married in quotes, but because they have started cohabiting and living together and giving birth together, they believe that they are married. In this situation, I don't even know how we're going to do with it because this one is more of a risky factor for those kind of marginalized women. We should also talk and look into the situation. Thank you.
Thank you very much for that beautiful contribution, Ejiro. I don't know if Odete is back now. Can you say something, Odete, as regards this? We'll proceed. Hello. Etami, are you with us? Hi, can you hear us? Hi, can you hear us? All right, so we just proceed with the discussion. Now we're talking about us introducing these contraceptives, to this adolescents. Some of them already take it. I will take example. I'll just share a brief about some of the experience I've had with girls during one-on-one counseling at the community level. Now we look at it. The one of them I met was a girl of 14 years, and then she just walked up to me, "Mom, please, I heard that you part in our family planning and all. Please, I don't know. I had sex with my boyfriend 3 months ago. And after that, I took mistoposto, just like one of us was talking about. And that after that one, she was just feeling some like body changes. She herself said she noticed some body changes. So she told her boyfriend told her that he's going to mix up something for her. And then he had to go on Herbal, and get some Herbal apps for her to take and the mix up and all. And at the end of the day, she began to have severe abdominal pains. And at this point in time, it was because she heard of the conversation we had. That was why she had to come. And then she said she does not know if she's even pregnant at this point or what is happening to her, and that she's noticing her novel is getting big. I just smiled. At this point, she was just asking, what do I do? And then I looked at her, you know, a girl of 14 years, probably she's still in. During the interaction, I asked her, have you seen your menstrual period between these 3 months? And she said, no, I did not see the that month of August. This was just last year. I did see it August. But I after I took the Mistupuso and some other things like that, I later saw it in just one day in I think in September. She saw it once, and after that day, she didn't see it again. And then after a week or two, she went back again to visit the boyfriend, and they and this all of this sexual intercourse that they're having, it's unprotected. So now, in this point, you know, so many of these girls, even when you're trying to tell them the right thing to do, some of them feel, oh, I beg, my boyfriend surpass whatever anybody is saying. What the guy says is what she has to follow, because she feels she's how do I put it? Let's say maybe she feels like she's the boyfriend will give her more of the advice. So I think it's very important, just like we've raised today, that our parents need to get involved at every point or stage of the girl child growth. So whatever concerns some of our parents, we've come to realize that even when the child is moody, the child has been assaulted, the child is going through a lot of trauma and pains, we fail to call them to order and say, oh, fine, come, I've noticed you're moody. What is going on? You know, you need to make your child your best friend. Are women out there that are listening to us today, please know that your girl child should be well-being should be prioritized as well. So you don't expect so that the child doesn't go to face whatever maybe you have faced as a mother in the past, or even if you have not, maybe your neighbor or whatever anyone around you has faced. You get. So thank you very much. So we'll be moving to another stage of our conversation. I hope you can all hear me, right?
Yes, we can.
All right. So we move to the next discussion on speaking on we've just shared a lot about this, and then so now when we look at all of these challenges and the roles that we have been playing as parents and all, what can we possibly say we have to do as CSOs to remedy this, beside our interventions in the community?
I think, hello.
All right, now
I'm in a very noisy place. I think after this I will want to sign out because I'm in a very noisy place actually. I think it all boils down on education, awareness creation on the side of the CSO to stakeholders, religious stakeholders, community stakeholders, even social media, because now these adolescents we are talking about, how many of them do you see in the church? How many of them do you see in communities now? All of them are being tied down with under social media. So I think it's more of social media thing, creating awareness, using social media, TikTok, Facebook, because that is where you can find most of the adolescents. And then because our parents, you can get them in churches, you can get them in meetings, group meetings, associations, but the adolescents, you get them more in social media. Because once one particular thing is trending, assuming we are talking about this unwanted pregnancy and we are trending in TikTok, the message goes fast. Before you know, it goes fast to the adolescents. You understand? So I think it's more of awareness creation, just to accelerate, just as we are talking about accelerating, taking action more on awareness creation on unwanted pregnancy, the implications. So I think that is the area I want it to be intensified more. Thank you.
Well, yeah, for that. So to others in the house who would love to share, make an input, Madam Patience, Would you love to say something to that?
I would like to contribute also.
All right, go ahead.
Well, I agree with my colleague that yes, we should create more awareness as civil society organizations, but I think for creating more awareness, we have to collaborate more and more, either in the I don't know, in the same country as local NGOs or at the regional levels also. And also, I think the usage of social media is important, especially to spread awareness to young people, adolescents, because I mean, as all we know, they use a lot of social media. So, and also I think they can, let's say, concentrate more when it comes to getting information in social media. So I think as civil society organizations, yes, we should create more awareness, but for creating awareness, I think collaboration at different level, partnerships at different level is important. And also at the same time, improving our social media contents also would be a great contribution for awareness, especially about the topics like important and delicate topics like, I don't know, SRHR and also gender-based violence, and also for basic rights and safe abortion and so on.
Hello. Hi, are you still with us? We lost you there. Hi. All right, so why we continue, we just love to take the contribution on the chat from Mustafa. He said there is need to be taught sexual reproductive health in our schools. If that is done, they will access platforms. Schools reach a large audience by young people, trained educators. Teachers are equipped to provide accurate, unbiased information. Said also age-appropriate content, that is curriculum tailored to schools' developmental changes. And then safe environment. Schools provides a secure space for discussion and questions. Also, integration with other subjects can enhance learning in health, sciences, and social studies. Thank you very much, Mustafa, for that contribution. And we have in the house Mrs. Abimbola. Hi, ma'am. Hello, can you hear me? Mrs. Abimbola, are you with us? Hello, ma'am. All right, maybe she's having a network issue. All right, so please, while we proceed, we like to request everyone to complete the attendance form on the chat. Please just go through the chat to see the attendance sheet and do all to fill it up, so that after the meeting you get the recording and some other information to take home from this. Thank you. All right, so we proceed with so talking about hello, can you hear me? So we're talking about how we can accelerate and promote gender gender gap in XRHR. So one of it, we will need to identify some of these key challenges women face while accessing SRHR in Nigeria. We'll speak in Nigeria context and in the global context. Now, we'll start from our end. Would say in this aspect, a lot of how do I call it? A lot of issues are on ground because many women, even when they're supposed to, would have easily gone to the health center to access some of this contraceptives, family planning. They prefer to make use of the chemists. They prefer to they prefer to go to the roadside chemist to get some of these stuffs, and then this have to now have causes side effects on them. You know, a lot of complications, and that is why we have limited people like women going for contraceptives. So one of the things that we have been doing at Age Network is to ensure that we train the informal healthcare providers in those local communities, because we believe at the marginalized communities, it's not all of those hard to reach communities who might be able to get in touch to. And I know we're still intensifying our efforts to ensure that we get to those people that needs more of this information and more of this health services that we can offer from our end. So what we do is to train the informal healthcare providers, because we believe these are the people that are the first point of contact to those women and the girls in the community. So if a girl who could walk up to you as an informal healthcare provider to say, I need a contraceptive, or I just had sex and it was unprotected, how do I, the person should be free enough to communicate to you. But in most of the health facilities, by the time you get there to talk, maybe as a teenager, you walk up to them and tell them, I want this. There is this stigma surrounding this. And this is why we have been working with the training the healthcare workers as well, in line with alongside the informal healthcare providers, to ensure that they're able to provide non-judgmental information to these people. You understand? When they come to them and they get the right information, they won't be stigmatized. They will not feel the pressure, or you know, the fear of going for this. But by the time they have the right information, they're able to undergo some of this, and instead of going to the chemist. And even when they get to the chemist, the chemists who are the informal healthcare providers, the pattern medicine dealers, we have been able to build their collaboration in some of these communities with the healthcare facilities. So if they come to you as an informal healthcare personnel, that I need this commodity, because you know you are not an expert in that field, you need to refer them. So we've built up that referral method for these people to be able to get to the health center easily without being stigmatized, and they get the necessary information. So we would love to hear from our end what we have been doing in a various perspective, and more we can do to ensure that we remedy some of this this situation of stigmatization, discrimination in our society. Hello.
It says
All right. So I hope you can hear me, right?
Yes.
All right. So we'd love to hear from every one of us. So we just have 5 minutes for that. So whoever is waiting to talk, we just have 5 minutes to share, and then Generally, so 1 minute for each person, or maybe I have a minute. All right. So who do we start with? Madam Abimbola, would you love to go? Are you with us? Hello? Madam Patience, would you love to share?
Sorry, the network, my system froze. Were you asking me a question? I couldn't hear you at some point.
Oh, sorry. We're just discussing about how we can reduce the stigma that surrounds women access to sexual reproductive health services in health facilities. And then at age, we've been able to share some of the methods we've put in place to ensure that we are able to address these issues. So we'd love to hear from other CSOs in the house how we have been able to contribute to remedying the or reducing discrimination and stigmatization in our various regions.
Okay. Can you hear me?
Yes, we can hear you.
Okay, for the few women we've come across, what we actually do is we have nurses, we have medical people in-house that will refer them to. So they go to either their clinic, their hospitals. So they really do not have such because we're working with volunteers, we have not, because we've not started doing this for a long time, but we've not really experienced that for now. So we get them to talk to the medical people we have on the team, and they bring them in, they attend to them. So for now, we really have not had that experience.
All right, thank you, ma'am. Thank you so much.
All right.
Madam Patience.
All right, thank you very much. You talked about how we can reduce stigma surrounding women in healthcare workers, right?
Yes.
I think if the healthcare workers are being trained, sensitize them on the gender equality, gender as a whole, it will really help. And also keep conducting a community outreach where we engage the community, same the health workers in local facilities. If we educate them, continue community outreach, it will help to reduce the stigma, because some of these healthcare workers don't actually know the attitude they even give. They don't even know it's stigmatizing that they are doing. They think it's normal because they don't have knowledge of it. So I think if they are being trained, and it will reduce. Thank you.
Very much, ma'am. Thank you very much, ma'am. So we'll be moving straight to the next on the list. So we'll be taking on legal policies and framework we can put in place. So this is a general conversation where every one of us is going to bring in our contributions, matters a lot. So now they are we know for a fact that for every society, let's say in a society, we have legal policies that binds us. Their policies, their laws that binds us. So now in this section, we're going to be talking on how are there any legal and policy framework that promotes specifically, sexual reproductive health and rights, not just in Nigeria alone, but in a general context, in the global context that we see. So we would love now to call on our panels to start the conversation. So we have Madam Patience. Would you love to go first? Hi, Chinyere, would you love to go first on this? Hello, can you hear me? If you can hear me, let me know you can hear me, please. All right, so hello, I hope I'm not talking to myself, right?
Hello.
Hi, Ejiro. Hi, can you hear me?
Yes, I can hear you.
All right, all right. So, Goze, would you want to go first?
Yes, sure.
All right, thank you.
You are welcome. Well, I don't have any expertise about Nigeria, unfortunately, but I can contribute with, let's say, international perspective.
Exactly.
If it's okay.
Yeah, sure, go ahead. Yeah, sure.
Thank you. Well, I mean, from international perspective, I can give example from like international treaties, like international human rights law treaties. For example, I can address Universal Declaration of Human Rights and also Convention on the Elimination of All Forms of Discrimination Against Women, and also Beijing Declaration and Platform for Action. I mean, there are specific articles dedicated to sexual and reproductive health and rights. But their problem, unfortunately, it's that they aren't legally binding because, I mean, for they are being legally binding. There should be national laws which are compatible with international law. So even there are regulations and law to promote sexual and reproductive health and rights. Unfortunately, there's still a huge gap between the compatibility between international and national law. So yeah, it's still problematic when it comes to let's say forcing legally SRHR international SRHR standards because the topic's still very delicate and it's like a taboo in the areas like Africa, Middle East, and so on.
Thank you very much for sharing that. So, hello, do we have any other person that want to go next? All right.
Okay, so sorry, you called me. I had to just go pee.
Sorry.
I'm trying to your question.
Are there any legal and policy frameworks that promote SRHR in Nigeria and in the global aspect?
We have HIV/AIDS anti-discrimination law. Yeah, I think we have that in Nigeria. I think in certain states. This is quite large. So I think we have a lawyer that's sorry, I don't really have full idea on it, but since we are working on HIV, I know that we have a law on HIV and AIDS. Yeah. So.
All right, thank you very much. Kere, would you love to share on that?
You mean on HIV and AIDS?
Yeah, you can as well share on that.
Okay. So for the law on HIV and AIDS anti-discrimination talks about, of course, people who go about maybe for example, you're a field worker, you know the status of your client, and you go about exposing it and talking, having a third party about one status that you don't have, the person have not given you a consent to share. I know, there is a penalty for that. Yeah, so that's it. Thank you. Did you hear me? Hello.
Yes, ma'am. Thank you very much. Thank you very much. Madam Chinyere, are you with us? Are you with us? Hello.
Hello.
Hi.
Okay, if I may add, talking about laws in Nigeria that has to do with SRHR, where I don't know if we really have law that address a full package of SRHR. But we know that we have what we call the law to life. You understand? So since we have the law to life, means that it kind of, hello, can you hear me?
Yes, we
Hello?
can hear you.
So when we have the law to life, thank you. The noise is much. You can hear me clearly.
Very well.
Yes, we
Okay.
can hear you now. Go on.
Like I said, I don't know if we have a full package of policy that's on the SRHR. You understand? But we have what we call the law to life that allows a freedom of whatever you want to do like that. And then we have the law that talks about stigma when it comes to HIV, meaning that there are laws of wrong disclosure or consent. Maybe you did not take, in fact, you are not even supposed to disclose somebody's status except the person gives you consent. Those laws are there and they are all in the discriminating out of when it comes to HIV. I think we also have this law, the VAP Act law that talks about discrimination against, I think, is it human person or something like that? But some of these laws have not been fully adopted by the whole state. Even the one that I said to be adopted, are they really working fully? They are not actually working fully because most of these laws are being, put there, but they are not actually functional. Because everything in Nigeria has taken what we call money and influence. Even if a marginalized person knows about this law, how will this person do with this law if she doesn't have the influence or she doesn't have the connection, if she doesn't have the money? And I think this is the reason why this topic is good for today. And then every CSO is supposed to come together and see how we can work towards making these laws to work for our people in Nigeria. Thank you.
Thank you very much, Ejiro, for that contribution. I don't know if Chinyere wants to say something before we open up for others to speak. Hello. All right, so Mustafa, would you love to say something? Madam Esther, would you love to say something as well? So just proceed. Hi, Chinyere, we can hear you. Hello, please, if you're having a network issue and you know you can't unmute, or probably because environment where you are is noisy, you can as well chat on the drop it on the chat, drop your contributions on the chat, and then we'll take it from there. All right, so now Ejiro was just sharing. Ejiro just shared about some of the laws that we know. Yes, in Nigeria we have some laws that has been put out, but majority of those laws are not functional. Now, take for instance, talking about budget allocation. Aishin, you want to say something? Hello? Can you please type on the chat? Since your network is not stable. If you can hear us, please just type on the chat. We'll take it. We'll take your contributions from the chat. Thank you. All right. So as I was saying, we have quite a number of laws that has been put out, but many of the states are yet to adopt them into, would I say, curriculums or into action for it to work. And that is the essence for us to gathering here, so that we can be able as CSOs to come together to, deliberate on how we can accelerate these laws and make them functional. Those ones that are not functional, we make those legal laws functional, those policies work out. If they are not like policy framework, specifically that maybe in the allocation aspect, maybe allocating a budget, particular budget. Like for instance, we had a section, a training for with the budgets, the ministries, and we came to realize that some of these agencies are yet to prioritize, SRHR into their budget allocations. Yes, we take for instance, just last year, even we attended a meeting in one of the states and came to realize that, oh, fine, in this states there is no budget allocation for them. So we had to carry out a gender responsive budgeting training for these agencies, and there we're able to at least ensure that. And then since then, we've been following up to ensure that they are able to make sure that they put in, an allocated figure or sum for SRHR, specifically on family planning and contraception, so that it will be easier, because this is one way, once these things are made available, it will be accessible by all, because once it's made available in all health centers and facilities, the women will be able to walk in freely and accessible. Once the price is, look at it from this aspect, quite a number of these women in the community will tell you, I don't have money to go and pay for family planning. I cannot, it's better, let me just stay like this. That is because they know that by the time they get to the health facility, they will need to pay some figures for the maybe registration and some other things. And at the end of the day, if they are not able to afford the fee, they won't be able to get it. So this is why some of them don't even waste their time going to say they want to opt for family planning of any kind. So please, hello, can you hear me?
Yes, we can hear you now.
Yeah, all right. So as I was saying, quite a number of women feel that there's no point for them to opt for family planning because there are specific fields. Yeah, and of a truth, yeah, we are from our end at Age Network, we decided to go into having paying advocacy visits to some of these key stakeholders, especially the ministry, just to engage them to ensure we know. And then the PACs, and we came to realize that some of the PACs in the communities will say, we are also paying from at the state level. States are also paying for paying to get commodities from the federal. You can beat that. So by the time the state pays to get the commodities from the federal, it is not possible for them to give out freely to those women. So the women have to pay for it. So at this point in time, it becomes even difficult for the women to say they want to go for family planning at the health center. Some of even the adolescents will never want. Is it if a woman cannot afford it, is it the adolescent that will be able to afford it? No, of course. So that is why we have some of these increasing rates of unwanted pregnancies that we are seeing, and that is one of these the things we can do to ensure that these laws are functional is us as CSOs coming together like this to discuss. So now we want to deliberate on how we can come up with what do we do to ensure that these laws, these policies are made legal and functional. And then some of these you know, let's say for instance, allocations of funds or HRA is being put in their budgets at every year when they allocate some figures to SAN. So they should be able to allocate funds for SRHR. So please, how do we go about this as CSOs? So we're not going to speak in Nigeria alone. We're going to share generally because I believe some other places will also might be facing the same thing. So we take first from the panels.
You know, and you know, when I don't change that.
Hi, Ediro, please. I think you were saying something. Hello? Are we still together? Hi.
I can hear you.
Costa, would you love to say something about this?
Yes, but can you please repeat again the last sentence that you said because my connection was really bad.
Sorry?
I was saying I couldn't hear your last sentence, last question that you asked because my connection was really bad.
Okay, so
hello.
I was just saying that how can we as CSOs from our various regions advocate for make laws and prioritize sexual reproductive health in our various regions, because quite a number of women are unable to access some of these sexual reproductive services because they are not able to afford it. So how do we how can we make this work?
Yes, like
Okay, if I may come in here. Hello. Hello.
Give example from and hello.
Hello, the network is actually very bad. Can't hear anybody for now.
Hi.
Okay, can hear.
Hi, proceed. We can hear you, please.
Okay, if I can come in, can I say something?
Yes, Ejiro, you can.
Okay, talking about how we can come together to work. Well, first of all, the CSO need to come together to address this issue. First of all, I believe we need to just find out what is the common issue. Why are this policy not being not efficient or not working? Why are this policy not being followed? We need to look into that. To look into that, we need to have a kind of a meeting. Maybe there is a lead CSO that wants to push this thing forward and have a meeting calling all the CSO that are into a kind of gender program or SRH program to get more ideas from each of the CSO. This should probably be either on a roundtable discussion or in Zoom like this, as we're saying. But then in the discussion process, there should be a time limit, because every CSO have one thing or the other they are doing. That is number one. And then we need to identify which right holders or stakeholders are we meeting, do you understand, to address this issue? Which right holder is going to be met to address this issue? Plan out the date, plan out how to link with these people, and then have a meeting with them. And it's not going to be a one-day thing. It's not going to be a one-month thing, you know. For you also have impact of this thing, it's a continuous process like that. So the first thing is to identify the stakeholders that are needed to do this policy reform, or to meet the the CSO first, and then we decide on the stakeholders that are needed to be met. That is my own suggestion.
Thank you very much. Thank you very much, Ejiro, for that. We'll be wrapping up now. We are opening up for questions and contributions generally from everyone. So we'll be wrapping up. Mustafa, Odete, let's check others. Any more contributions from our end? All right. In the absence of questions and contributions, we've taken. We'll be coming to conclusion on this section today. And overall, our discussions today has made us to know that as CSOs and as women, we have key roles to play in advancing sexual reproductive health rights of our women in our various locations. And then even as CSOs, we have more to do. So we've been working. We want to say thank you to every one of us for the work we have been doing, and we are expecting to do more to ensure that we remedy some of the situations as discussed under the legal and policy frameworks. We are going to be working after this to get in touch with other CSOs to ensure that we intensify our efforts to ensure that the reproductive health rights of our women and girls are being prioritized, and then every law that is not functional is made to function effectively, so that the women, especially in the aspect of budget allocation for family planning and contraceptions, and generally extrajudicial in a society, especially in Nigeria, is going to make to be functional. So please, as we go, can we all unmute our, open up our camera again to just take a picture, and then hello, Ejiro, please, can you open your camera? Odete, Mustafa, we're going already. And all right, thank you everyone once again for making our time to be here. And it was really an honor to have you all on this conversation, and it was really mind-blowing. And I want to say we've learned a lot from you, and we've also shared our works, and we look forward to how way forward to building sexuality education for our women and girls. So to our women out there, to every one of us here, happy International Women's Day 2025. And we hope to see you in the next one to come, even also in another roundtable discussion that we'll be having. Thank you all for coming and for your time.
Happy International Women's Day to you too.
Yeah, thank you. So thank you everyone for being here. So bye.
Bye.
You have a wonderful weekend.
Same here.
Yeah, bye.